This is Delhi. Please stand by for our next program. This is All India Radio. In our national program of talks tonight, we bring you an interview entitled It's a Matter of Heart, in which eminent cardiologist Dr. O.P. Yadav is being interviewed by Ms. Anita Thapar, media personality.
Hello everybody. Today on this program of ours, our topic is It's a Matter of Heart. And we're very fortunate to have with us Dr. O.P. Yadav, eminent cardiologist. Dr. Yadav, welcome to the studios of All India Radio.
Thanks, Anita. Pleasure.
Doctor, I'd like to begin with a very, very basic question. What exactly do you mean by the term cardiology?
See, as most medical terms have evolved, they have come from either Latin or Greek basis. So if you look at etymology, it's got two parts, cardia and logos. Cardia in Greek means heart or the upper opening of the stomach. Those days, we didn't know where the heart is and the stomach is.
Okay.
So that's how the word cardia derives. And logos means knowledge. So from the Greek derivation, it comes knowledge of diseases of the heart is called cardiology.
So basically cardiology, as you just mentioned, deals with the disorders of the heart. Doctor, a very personal question. What made you choose this field of speciality? An honest reply.
Oh, yeah. I mean, I must say that it's probably infatuation. I still remember, and vividly I remember, I don't know what, class 6 or 7. That was 1967 when the first heart transplant was done in Cape Town, South Africa by Christian Barnard.
Right.
And in that heart transplant was sort of an emotive issue. It was on the front page of the newspapers. And somehow heart binds to the audience, much more than kidneys and the spleen and the livers. And that heart transplant became such a thing, and I didn't know what cardiac was those days. But heart transplant sort of got me into, I want to become a heart surgeon at class 6 or 7, and that's how I carried it.
Really so early in life?
Yes.
Wow, that's very interesting. Doctor, of late, medical researchers tracking India's cardiovascular disease burden are witnessing cases more frequently as compared to the past 2 decades. And unfortunately, this has been observed not only in the metros, but also in the poorer states and rural areas. According to your expertise, what are the causes contributing to this phenomenal rise?
Well, certainly there has been a rise. Now, there are two important elements to it. One is that there is an absolute rise, I grant. But there is also more awareness and detection of the disease. So people are coming forward, and people who were not earlier diagnosed are now being diagnosed. So both the factors have contributed to this kind of an increase. Now there is a epidemiological transition. What I mean is people from the rural areas are now migrating to the urban areas, and even if they're staying back in the villages, their lifestyle is urbanized, from media and from all kinds of dissemination of knowledge. They get exposure through televisions, through the WhatsApp, through internet. So they are adopting a kind of high-calorie, refined and sugary diet and giving up on the what we call in Hindi as mota anaj or roughage, diet full of roughage like millets, sorghum. Those have come down. But if you look at simple sugars and starchy foods, their consumption has gone up by almost 200%, even in poor countries and poor backgrounds.
Really?
Yes, because they are relatively cheaper also. That's one. Second is the physical activity has gone down. You find that a lot of villages have now got mechanized systems of irrigation and farming and tractors and so on and so forth. So that physical activity has gone down. Smoking levels have, if at all, increased or remained static, and the women seem to be catching on much more than the men. That's a negative factor. And the stress level in the new generation is much higher than what it was earlier. Those family bondings have broken down. Today we are looking at, nuclear families stuck on their computers, not playing outdoor games. So it's a kind of multiple factors which have contributed to this so-called tsunami or epidemic of heart diseases which you referred to.
So it's basically a change in lifestyle, whether it's for the rural sector or the urban sector. It's basically a change in lifestyle, and that includes diet changes and, the physical activities are not there anymore. as it used to be in the past. But what happens if there's a family history of heart disease? Can that be overcome, or is one, genetically doomed to suffer the consequences?
Well, you can't say genetically doomed. That would be kind of a little provocative and too stiff.
Okay.
But yes, there are two elements, and we use it in teaching. There is a nature and there is a nurture. Okay. Nature is the genes. Yes, if you have either of the two parents having heart attack, your chances of getting a heart attack are 2 to 3-fold higher. If you have any one of your siblings also having a heart problem, then your chances of getting a heart attack go up by 5 to 6 times. So that's the level of influence of genetics. Also, don't forget that we in Southeast Asia, when I say Southeast Asia, Bangladesh, Nepal, Sri Lanka, Pakistan, India, we all fall in that same bracket. We have a genetic predisposition. We have what we call a genetic predisposition to a technical word, metabolic syndrome. Now, metabolic syndrome is, if you look at, we have very skinny legs, thin legs, but we have a paunch. All of us.
Okay.
You cross 30 and you stand across the mirror and you will see your stomach protruding outside your chest. No, stomach is supposed to be scaphoid. Abdomen has to be scaphoid. Means when you breathe normally, standing side on in front of the mirror, your chest should be outer, your stomach or the abdomen should be inside the silhouette of the chest. But that doesn't happen. All of us have this pot belly, or which we call in Hindi tond, which comes out and protrudes. And this visceral obesity or pot belly, even couple of kgs, is responsible for heart attacks, which we don't see in the Western population. Then we have higher incidence of high blood pressure. We have insulin resistance, so our diabetes rates are much higher. If you look at our cholesterol, the good cholesterol called HDL, which should be high, preferably 50 and above milligram percent, in all Indians, you find it somewhere hovering around in 20s.
Oh, really?
So these are all a conglomeration of factors which combined together are called metabolic syndrome. So we are prone to metabolic syndrome. So we are genetically predisposed. And even third generation naturalized Westerners, 3 generations back, family has migrated to America. Now the grandchildren are no more Indians. They are eating, drinking, sleeping, breathing Western habits. Yet they have 3 times higher incidence of heart attacks than the Caucasian native white population.
Ooh,
so that is the nature. But then there is a nurture. Nurture is how you lead your lifestyle. And nurture can counteract the nature.
You can work your way around it.
You can work your way around. If you do regular physical activities, don't indulge in substance abuse, no smoking, no alcohol, look after your stresses and go back to the tenets which our seniors and elders taught us. Yoga, meditation, pranayam, meditation in terms of poetry. There is a very famous study called PPP study, which is called Poetry, Pranayam and Prayers.
Okay.
So they are the 3 Ps. And it is a MRI based study. Means it's not something which some person on the street, has come out with. This is a MRI proven study that patients with heart failure who did these 3 elements, poetry, prayers and pranayam, they had better long-term outcomes proven by MRI studies of the brain than those who did not do these. So now we are looking at these holistic ways also, and this is all the nurture. So it's the competition between the nature and the nurture, and once the nature is against us, at least we can take nurture.
Yes.
And bring that nurture in our favor to counteract that nature.
We can basically weave it into our lives.
Yes.
Well, coming to a critical question, if there's one name that's on everyone's lips nowadays, then that happens to be the global villain, or simply Corona. Doctor, does COVID affect the heart?
Yes. COVID affects virtually any and every system and organ of the body. And heart, obviously, is not going to be spared from it. Now, there are multiple ways of COVID, affecting heart. One is direct, means the COVID virus gets into the cells of the heart and produces myocarditis. Myo means muscle, and carditis, we just talked of, cardia means heart, itis is inflammation. So inflammation of the muscles of the heart is called myocarditis because of direct virus getting inside the muscles of the heart physically. That is, it's present there. Now, similarly, it can affect the covering layer of the heart, what we call pericarditis. But then there are other ways in which the virus can affect the heart, and those other ways are much more common, indirect ways, than the direct way. And the indirect way is whenever the virus enters the body, human body mounts an inflammatory response to fight against the virus. And it is true for the entire COVID. The virus did not cause as much damage as was caused by the inflammatory response mounted by the body. So when the body responds to the virus in a hyper exaggerated way, the immune response also damages the heart. That was the main damage which occurred to the heart. And the third way in which the heart is affected, and which is very devastating, and that's the way which most mortalities or deaths occur, is by predisposing the blood to clotting. So when blood clots start forming in the arteries of the heart,
Right.
then you get heart attacks.
Okay.
And those heart attacks, when person looking very well, just fully recovered and suddenly drops dead, they were mostly due to clots forming within the arteries of the heart.
Okay.
So COVID affected us in a number of ways. And then it also produces irregular rhythms of the heart.
Arrhythmia
And that arrhythmias can also cause serious problems.
also.
Absolutely.
What about those people with a history of heart diseases or people with comorbidities? Is it safe for them also to go ahead with the vaccination?
Beyond doubt, it's very safe. You can have vaccination. And also it is important, as a corollary question, if I can sort of answer that, a lot of people we know in the phase 2 and the phase 1 of the COVID, it was much better during the third phase.
Right,
But in the
right.
first 2 phases, they stopped certain medications. A patient.
What do you mean certain medications?
Well,
doctor?
one of the mechanism of action of the coronavirus, how it binds to the receptors of the human body, is through what we call ACE receptors or ACE receptors. It's an acronym. I'll not go into the full form. Now, those ACE receptors are also responsible for blood pressure control, and certain medicines called ACE inhibitors for blood pressure control were also given, the patients were taking. So if a myth kind of generated and got spread like wildfire, that ACE inhibitor medicine should be stopped. And ACE inhibitor medicines are extremely, extremely useful for heart failure, for blood pressure, for lots of other diseases. And that created massive havoc. Patients with stable heart failure became destabilized. They presented to the hospital with heart failure. Patients with controlled blood pressure came with accelerated high blood pressure, and kidney patients also deteriorated. So the message I want to give, even if you feel that you are getting some harmful effect of a drug, please do not stop the drug of your own, especially due to COVID or any other reason. Please present your problem to the doctor and let the doctor take a decision. And 99 out of 100 times, these medicines are not causing your problem and they need to be continued. Otherwise, your corona and COVID disease will be much more fulminant.
Right.
If your underlying comorbidities are not controlled.
So basically, we shouldn't be taking things into our own hands.
No,
Okay.
absolutely not.
Doctor, in a nutshell, and again my question is aimed at these uncertain pandemic times, how can parents and also the school authorities contribute to healthy hearts vis-a-vis the children?
Well, all healthy heart and health-related issues, I strongly believe, must start in the school. In fact, if I can recount a small little, may make it a little longish, in the Vietnam War, one important thing which came out and which was a big bane out of all the bane of the wars, one big boon which came out of the war was realization that disease process is occurring much earlier than what we generally think. We think that heart attacks and heart diseases will occur when you cross your middle age, you go beyond 40 and 50, and they are diseases of the old age.
Right.
No. When they did autopsy, that is postmortem, of young soldiers dying in the Vietnam War, they realized that they had streaks of cholesterol deposition in the arteries of the heart. This was a collateral finding of the autopsy studies of the Vietnam War. And then they realized that this disease was present in 18-year and 20-year-old soldiers.
Very young.
Very young.
Very young.
Then the second thing was, you must have heard of the Red Nose Day. Red Nose Day is when they wear red nose, just like Indian Flag Day, when we sell little flags and raise money for the war widows. The Red Nose Day is celebrated to raise money for what is called sudden infant death syndrome. Sudden infant death syndrome is nothing. A baby, 2, 3, 4-month-old, has mother's milk, absolutely fine, sleeps well, and supposed to get up after 4 hours to have his next feed, but doesn't get up. Parents are happy. Baby sleeping peacefully, another 2 hours, 3 hours, and then suddenly they try to wake up the baby doesn't wake up.
Well, that's shocking.
And the baby is no more. This is called SIDH, means sudden infant death syndrome. We till date 2022 do not know the exact cause. So the Red Nose Day is celebrated to raise funds for research on this. And one of the findings of the research, in babies less than 1 year old, there was cholesterol deposition in the arteries of the heart.
Could this be
And
when the mother is expecting and
absolutely,
she has...
You have hit the nail on the head.
Okay.
And that is why we are now talking of that the disease begins not in school, not begins in the childhood, but it begins in utero. That is when the baby is in the mother's womb. So what the mother eats, and therefore all these, bonsam baby contests that we had when we were young, and they have been all banned. All these food supplements. We don't advocate any food supplements for babies till 6 months or 1 year of age. They are supposed to be in the mother's milk. And all these diseases begin in utero. So school is extremely important. What we eat in the canteens, we eat junk.
Absolutely.
It has become a money-earning wing of the school. No, they have to look what they're serving in the school. And the children have to be put through that 1 hour of physical PT and parade and games that we used to have.
Absolutely necessary.
It's finishing.
Yes.
Recess time, we hardly ate our lunches. We were always playing hide and seek and fighting, and those are important elements. We must go back to physical contact. That's prime requirement of schools.
Well, that was really, really informative, Doctor. A question a lot of people have in mind, and which is a cause of concern, is what should a person do if anyone in the family experiences symptoms of a heart attack? What are those first aid cardiac tips which you would like to share with us?
Well, first thing is that never put anything in the mouth of the person. Invariably, we find that people are giving some kind of cold drink, hot drink, patient is unconscious, you try to wake him up by putting certain drops. All of this in a patient with borderline consciousness, all of these drops are going into the lung, and that is creating more disaster. So what you should do is immediately make the person lie down. If the patient is fully conscious, reassure the person and give him a tablet of aspirin, which is dispersible aspirin. You get it by the name of Dispirin. You get it by a number of things. Mix it in just a gulp of, in a small, 10-20 ml of water, and ask the patient to drink that and rush immediately to the hospital. Do not try to put anything in the mouth. And if the person has lost consciousness, then put him on the side.
Okay.
Don't let him lie on the flat with his
Which side
back.
preferably, doctor?
Any side. The aim is that whatever saliva and the tongue, which can go, saliva can go in, the tongue can fall back and block his airways.
Okay.
So by putting on the side, you are ensuring both the things. The tongue does not fall back and the saliva starts drooling out. And then rush immediately to the hospital. Beyond a tablet of aspirin, you cannot do anything. Yes, if a person is a known heart patient, he may be carrying sorbitrate in his pocket. That every heart patient should carry and must carry a small little slip. We give identity card sometime in case of emergency. What is the emergency contact number?
Okay.
And a tablet sorbitrate under the tongue. That should be done. And the tongue should be wet when you are giving sorbitrate. But that is only when you are fully conscious,
Okay.
not in an unconscious patient.
Dr. Yadav, what are the challenges you face as a medical professional?
Well, challenges I face is one, the biggest thing which I have noticed in my own lifetime is this trust between the doctor and the patient is getting lost. I'm certainly not for that godly pedestal that you put the doctor on. No. Doctor should never be put on that godly pedestal. We are one of the society. We do our job, which is as valid as a sweeper sweeping the floor or any other person doing whatever so-called menial job. No job is menial. So let the doctor not be glorified. Let him be kept very much on earth and not put on a godly pedestal. But the doctor-patient relationship, that distrust which has come in, that should go away. I mean, those were the good old days when a patient would not only come to a doctor with his disease, he would also come to the doctor for his family problem. He will also come to the doctor to consult, look, I want to marry my daughter, I'm trying to find a match, I'm not able to find a match. Okay. That's the bonding I love to have that. And second, an offshoot of this is the violence which has crept into medicine. Violence against the doctors, against the hospital, and it's a direct offshoot of it. And I think the blame is both sides. The society expecting that doctors will work miracles. You have abused yourself for 40 years. And then you come into the hospital with a heart attack and you want doctor in the next 6 hours to redeem you like a phoenix. No, he can't. Mm-hmm. We are not ready to accept any disease and disability. So expectations of the society, the aspirations of the society, and a doctor's behavior, today, money has become the deity. And that is, unfortunately, the commercialization of medicine has taken place.
True.
So those are larger issues we can't discuss probably. But I think that distrust and the violence is the biggest challenge to medicine today.
So what's your mantra for dealing with stress?
Well, my mantra is do to your patients as you would have done to yourself. Okay. So when a patient comes and says that, look, do I need a bypass or not? The question that I must answer is, with this kind of blockage, would I have undergone bypass? Because a lot of time in medicine, there is a dichotomy where the answer from my side might have been no, but for the patient, I do say yes.
Doctor, talking about bypass, something just cropped up. What do you mean by minimally invasive surgery? I think this is related to the bypass.
Yeah, it can be minimally invasive is for the entire spectrum, the whole surgical gamut for the whole body. Normally we have been doing surgeries. If you look at abdomen, removing the gallbladder 30 years back, we used to open the whole abdomen and then remove the gallbladder. But nowadays we are opening through small ports or small cuts, 1 centimeter and smaller, a few millimeter cut, and you put in a telescope and a laparoscope inside, and then you do the surgery. So these minimally invasive techniques, which developed mainly in the abdomen, are now being developed for cardiac as well as other application for lungs. We have what is called VATS, or video assisted thoracic surgery, where you can do lung resections, you can do lots of procedures through those telescopic ports, which are very user friendly. Patients recover within 24 hours, some of the time within 48 hours they're ready to go home and start resuming work. So when you do these surgeries through small ports, then they are called minimally invasive, because you're not invaded the body as in an open surgery.
The healing process would be much faster.
Yes, but it's not that minimally invasive is applicable for everything. There are limitations to it, and especially in cardiac field there are tremendous limitations, because heart is a moving structure. Imagine if you have to write a letter and you're writing on a moving bus. So there is issues. So yes, certain procedures can be done very well through minimally invasive route, but certain procedures cannot be. that decision has to rest with the doctor.
Doctor, it's been wonderful talking to you. It's been so educating, and I'm sure our listeners will benefit immensely with all this information. Thank you so much for your time and your expertise. Thank you, Doctor.
My pleasure, Nida.
You were listening to our national program of Talks Tonight, which featured an interview entitled It's a Matter of Heart, in which eminent cardiologist Dr. O.P. Yadav was being interviewed by Miss Anita Thapa, media personality. Produced and presented by Naveen K. Gupta of All India Radio Delhi. This program came to you from the Delhi station of All India Radio.